Okay. Good evening, ladies and gentlemen, friends and colleagues from the dental fraternity. My name is Ruben Lobo, and on behalf of Dentist Channel.Online, I warmly invite you to this webinar to explore this wonderful world of the usage of ozone in oxygen therapy and the usage of ozone in dentistry in the various fields of dentistry. Friends, today we have with us two special speakers all the way from Italy. Italy is not just famous for its food, for its cuisine, for its people, but definitely for the technological advancements in the field of dentistry. We have with us Mr. Marco, the export manager from the company called Galbaiti, as well as Alessandra, who happens to be heading the marketing team of the same company, Galbaiti. We were supposed to have with us Dr. Babando, who was supposed to share a presentation. Unfortunately, he's not with us. However, we'll be sharing a presentation wherein he has already recorded the lecture, and the same would also be presented in this particular webinar. Friends, without much further ado, I'd like to welcome our first speaker, Mr. Marco, this evening. Mr. Marco, thank you so much for joining us for this webinar. And I look forward to you sharing some information with all our participants, as well as I warmly invite Alessandra to this webinar. Thank you so much for your time. And it's now time for us to get started with the webinar. So over to you, Mr. Marco. Thank you.
Welcome everybody, my name is Marco Iotti, I'm sales manager at Galbiati, Italian company manufacturing dental units since the year 1935. It's a great pleasure for me to be here and present you the following video that will show you a real case study on the incredible effect of the ozone in dentistry. Galbiati is the oldest Italian company manufacturing dental units. During the years, we have then added other products, and we have steam sterilizers, osmosis system, and ozone device. Our mission is connected to branding, increasing the world awareness with our innovative products. Design, ergonomy, easy to use, efficiency, problem solving. We help our customers worldwide. Quality, the highest quality products at reasonable prices. And then our brand values, made in Italy, reliability, design, tradition, innovation. In both our mission and brand values, we have innovation. That is the reason why we are now in ozone device for dental use, and we are here today. These are our products. The sterilizer Prima, very fast, made of stainless steel, top quality. A2O Prima, it makes the right quality of the water for our machines. Dental unit, ergonomic, user-friendly, innovative, different configurations available. And finally, ozone. Finally, we can tell about the ozone. Ozone kills bacteria and inactivate virus. A3O black is for the sanification of all the water that enter into the dental practice. It is directly connected to the city water supply. We have no chemical or dangerous residuals. Completely natural, the best possible solution. Linda is for sanification of the air of the dental practice and up to 1 liter of water for ganglions of the patients, for reducing the use of normal detergent, and so on. And finally, O3 implant. Ortho implant is the really wonderful and top professional machine that makes possible all you see in the upcoming video. The applications are in hygiene, treatment of caries, endodontics, oral surgery, very important in surgery, implants, very, very important. It is crucial to avoid periimplantitis, for example. That's really wonderful. Many other uses, like, for example, treatment of alveolitis and something like that. Ozone has really incredible results in dentistry. Galbiati Services means that we have founded our Galbiati Academy for the use of ozone in dentistry. And we can then provide training courses, one-to-one trainings. We have the right protocol of use for any application. That's absolutely crucial. We have collaboration with CIOT, that is the Scientific Society of Oxygen Ozone Therapy, officially authorized by Italian Ministry of Health. Now, just an introduction of the video of Dr. Babando. Ozone is an allotropic oxygen molecule. It is unstable, an unstable gas with a typical sour smell. It's composed of 3 oxygen atoms. It is an antimicrobial agent with very high oxidation potential. Ozone embraces all dental practice. As I've told before, it's applicable in many areas, such as caries prevention and treatment, endodontics, oral surgery, periodontics, implantology, and treatment of surgical implants. You as know, DentistChannel.Online will gather online all your questions and will give you the answer. Then here the promised video with our call, Dr. Babando.
We know that it has an antimicrobial, bactericidal, virustatic, and antifungal power. And from the publication, we can also see that it is due to the atom structure of this molecule, which is very unstable. The immunostimulant effect and immunoregulatory effect are known. It is also an anti-inflammatory and analgesic property. In fact, we can remove inflammation from all the mucosas. Thanks to the anti-apoxic effect, it increases the mobility of red glob, and it increases immunoglobulin and the use of oxygen from the tissues. We said that increases blood circulation and also the oxygen in tissues. It stimulates metabolism by releasing oxygen, and it also releases growth factor and endorphin that provide a feeling of well-being to the patient. It also has an immunomodulating effect and antioxidant power. My practice in the hospitals and as a private practitioner allow me to change my practice after I knew ozone. We use ozone to sanitize the workplace, water, and also all the rinsing fluids, physiological solution, and sterile water. It also can be employed in a wide, as I said, in the dental practice. We can treat water, air, and also the water used for the patients. And we can treat it with ozone. We completely changed our surgical practice. In fact, ozone can be used from the preparation of the patients at the surgical site the application on the patient. So we can also use it as a decongesting agent. We can also use it to diagnose and to understand the healing of the surgical site. We can also use it for hydrating grafting materials and maintain the surgical wound. And we are going to see in details all the treatments. In the dental practice, I said we can treat air with ozone, and the dental practice changes radically when we use ozone because you don't have the typical smell of the dentist, and you don't have any chemical residue. Ozone works by following. So if we spray ozone from a top level, we can then spray ozone everywhere, including inside drawers and everywhere. So we can decrease the environmental bacterial load, and we can sanitize and improve sanitization of the heating and cooling air equipment. We can use ozone to clean surfaces and improve disinfection. We can also lower the use of chemical detergents. Ozone is far better than chlorine in this respect because it decreases the allergy effect for operators. In fact, ozone compared to chlorine has a higher antiviral power, a high antibacterial power with a wide spectrum property. It leaves no chemical residues. Ozonated water can be used to clean the dental practice, but it can also be used in the hydraulic circuit. In fact, if we have an independent hydraulic circuit for the bowl, we can select ozonated water and use it in the bowl. This way, we have a sanitizing water available, and we can clean after tartar removal, and we can clean the oral cavity. The spray that can be used with the ablation allowed to decrease can create cross-contamination, but if we use ozonated water, we can decrease the risk of it, and we can decrease incrustation in bacteria. Ozone is active for all the pathogenic, including Escherichia coli. They are always used, and we can prevent all the bacteria like E. coli and Salmonella to remain in our circuit.
So we can disinfect also by using ozonized air, and we can go through the cold sterilization of tools, therefore preserving our cutting tools, and we can decontaminate our personal protective equipment, but also by using big containers, we can decontaminate also the mailboxes and also money, the cash money that we earn. Then on the left side, we can see Linda, which is an amazing machine. It is very compact, which allows us to obtain both air and ozonized water. Then on the right-hand side, we see a tank for cold sterilization with ozone, both instrumental and, of course, surgical. Now we can see the specific dental surgery uses of ozone. So patient's preparation, the rinsing is not done with chlorhexidine, instead is done with ozonized water, so with highly ozonized water, and it can decontaminate the mouth. So the patient is rinsing his mouth for 2 minutes before surgery. Ozone is also very useful for preparing the surgical field. In fact, we can proceed with ozonizing lavages solutions, but not only that, we can also obtain the cooling solutions, and we can maintain them hyperozonized with specific bags that allow us for having a continuous gas flow. By looking at the surgical side, I always inoculate before working on the surgical flap. I usually inject this oxygen ozone mixture for diminishing tissues suffering. Now we see on the right what happens in this case. So the patient has already done anesthesia. The patient was already anesthetized, and so we inoculate gas. Some other inoculations that I do are the immediate ones. So I've got some immediate ones and the late ones. The immediate one is under the flap dome. So once everything has been sutured, and we use high concentrations of ozone for using the bactericidal effect of the molecule. Instead, all around the surgical site, some other infiltrations were done at low concentrations for stimulating metabolism and prevent hypoxia. Now we've got the hemostatic barrier, and we see the post-op inoculation. So the patient in the post-op period, in the 2 weeks after intervention, will be asked to come to the clinic for receiving these late inoculations that are done all around the district. This is good for using the metabolic and decongesting effect. So, of course, the anti-inflammatory effect and hypoxic effect is fundamental in any type of surgery, especially when we want to perform a free graft, where we take a specific portion of the palate and we suture it on the site that needs treatment. And of course, we improve the metabolism and the revascularization of the graft by using ozone. So in the periodontal pocket, of course, we use all around the pocket for improving the site metabolism, but high quantities of O2O3 within the pocket, in the periodontal pocket, and it allows us to obtain a better decontamination and an easier healing with lower degree of suffering from the patient. So this is something that might happen after our extraction, and it is the alveolitis. The post-extraction alveolitis can be prevented, of course, by gurgling high quantities of ozone while the cloth forms. And this can reduce the bacterial load, bacterial charge, trying to, of course, reduce the very painful alveolitis following surgery. Periimplantitis is another pathology emerging. So we've got years of experience with implants. After placing them for many years, we can see that there's periimplantitis. So this is definitely a pathology that we have to pay attention to. Well, why? Well, because the implants are difficult to reach. They have kind of a scalloped surface, which is really difficult to decontaminate. And the regeneration around the contaminated implants is always a big risk. So using the great decontaminating power of ozone help us, and in addition allow us to be much more optimistic as for the good result that we can attain with the normal surgical techniques. Of course, we can improve the metabolisms of all the tissues around the suffering implant, and we can also, using kind of a mold, by saturating with ozone the area around the implant. This is something that we can do, as colleagues have already shown, and we can use ad hoc conditions for the patients. This is a great possibility given to us by ozone. So while performing late infiltrations, so we basically follow the healing process of the patient, and we can understand how the healing process is working. So very often it might happen that under the mucosa there is actually a suffering flap. So there's a mucosa flap that has not completely attached back to the underlying bone planes due to inflammation. And so we can also unveil these surgical treatments, these surgical healing. Whereas when we see the ozone is diffusing all over the tissue, it spreads as kind of a spider web. So that's very good. We can also strengthen the power of bone graft. And in order to hydrate the same bone graft, we can use hyperozonized water. This way, we can diminish the possibility of contaging the bone graft, well, at least during the first time as the cloth forms. Another great opportunity we have, because ozone has this antiviral, antibacterial power, we can use the fistula trait that the infection has created, and we can drain purulent material. We can use it as a tunnel, basically, for reaching ozone, for reaching the pathological area with our ozone gas. And very, very often we can avoid surgical recurrences, or at least we avoid a further surgical intervention, just because we can eliminate infection without operating from a surgical point of view. So getting back to a technique that was used in the 1980s, or in any case, many years ago, I used ozone, and I managed to use this technique, which is the dental implant. So now teeth have some canals that can be explored, yet cannot limit pain. So this, for example, is the case of a young girl who received an endodontic treatment on tooth 47. And even if the endodontic treatment was done correctly by my colleague, still there were symptoms of the pain. So when the tooth was moved, actually there were pains, and the patient was really suffering. She wanted to eliminate the tooth.
We agreed together to use this technique after my explanation. So we proceed with a dental implant. You see the MRI on the top right. You see also the tooth with the apex ready. Here you see the tooth in a container to allow to sterilize it using saturated ozone. So we created a temporary tooth for long-term use in position 47, and you see the MRI with a perfect healing. I use ozone toothpaste. It's a miracle on herpes after, but it also offers great protection for over infections of the surgical wound. So after the suture is made, we spread the toothpaste on the suture, and it also has a bactericidal effect, and it works like a barrier. Here you can see the inoculation before surgery, and we also see in the same case the decontamination of the surgical site using ozone. You see that we have high-speed aspiration to avoid the patient inhaling ozone. So in 2 minutes, we are sure that we completely decontaminated the surgical area. Here you see post-operation inoculation. Here you see a following inoculation, allowing to check whether there are some leaks of ozone from the flap. So the flap is completely closed. And here are some clinical cases. This is a particular case. The patient has this lower incisive tooth that was very much damaged, so she couldn't spend too much money, and had these severe lesions without some tooth already. The patient wanted to wait for financial reasons, and the fistula developed, although this is an easy surgical site, doesn't want to undergo surgery, but she doesn't want to lose the tooth. So we are going to work on the fistula, and we had a complete healing, although the dental element was not relevant. 2 years after, we visited the patient, and the situation was completely resolved. Unfortunately, we weren't able to include any picture of this visit. Here, another case, fibrous pulmonary scleroderma. This is a woman that has a limited possibility to be healed with conventional therapies. So we agreed together to limit the infection by inoculating high concentration of OO. The healing was complete and perfect. We are still controlling the situation, but we had no relapse, and 3 years have already gone by.
Questo secondo caso di chirurgia orale con
This is a case of a dental reimplant.
L'inserimento di un impianto nel primo quadrante dove il paziente
there was an implant close by.
e un paziente al quale era stato fatto
We didn't want to lose the dental element,
quindi
so in agreement with the
metteremo un
patient,
impianto in questa zona, un
we
impianto sommerso.
proceeded to reimplant the dental element. This is another case of dental reimplant. It's a very simple case. The extraction was simple, and it was easy not to compromise the alveolus. So we were able to successfully complete the dental reimplant. The sized lesion at the apex of this dental element is visible. You extract the tooth, you proceed with a careful curettage of the site, you inoculate ozone, and you can see that the reimplanted tooth fixed with the suture is here. At the end, you see the healing and a perfect MRI. This is another case. This is a decontamination of an implant with bone regeneration that was immediately associated to it. We leverage we see the hematose and pus on the gums. So before the surgical intervention, we decontaminated the surgical site. We lower the possibility of having complications. We used ozone, and you see the different steps of the healing.
So let's start talking about it before. This is a bone regeneration and a mini implant that had lost 5 millimeters of bone. So we decontaminate the area before surgically entering with ozone, and then we remove all the granulation aspects. So we clean again all the area. So we apply oxygen, ozone oxygen, both on the screw and on the operating site. We consider the different phases, different moments of healing, and we replace the crown on top of this implant. And bottom right, we see bone regeneration obtained with a very simple intervention. Just have to decontaminate with effective means our titanium element that we should decontaminate. So this is a case, perimplantitis, quite important. So there's an old lady with different pathologies. So she underwent decontamination of the plant with ozone, cleaning the surface of the plant, and we have obtained a great healing So we can see the non-inflamed tissues are there. So we need some adherent vestibular gum, but in a second time we will work with connective tissues as we have dominated the infection. So I can explain how easily we can decontaminate implants. This was a patient of mine who underwent implants 50 years ago. So she came 3 years ago with these clinical cases. So Q4 presents two implants that are united one with the other, a major one, and the major one, as I said, shall be extracted. So in agreement with the patient who didn't want to undergo any bone regeneration or intervention, she didn't want to spend also for further implants. She just wanted to use kind of a movable braces, but knowing that we can recover well on implants, the idea of transforming this distal element into an overdenture point pushed her to accept the surgery.
So this is a mobile implant with an attachment that is more efficient than the Bradistol attachment. And basically, we didn't burden the patient with any special cost. As I said, ozone has a great efficacy in natology. The temporomandibular joint suffers from imbalances when closing your mouth. And in these cases, we can avoid muscle contraction, hypoxis that can be formed in the temporomandibular area with subcutaneous injection. Owing to ozone, we can have a myorelaxing and anti-hypoxic effect. Patients already from the second application ask for the ozone therapy because they are used to live with muscle contractions and they find it helpful. You see the patient and how the therapy is performed. It's a therapy made of 4 inoculation. We allow the patient to open and close her mouth to find the exact spot, and then we perform the subcutaneous articular inoculation. You see that the gas is spreading under the tissues, and then we ask the patient to open and close her mouth so that we can allow the gas spreading around the area. Here we see some facts and figures. They are constantly changing, of course, because ozone is used. So I was saying that ozone is used daily. Me personally, I use ozone on basically every patient. As I perform many surgeries, I use it very frequently. And given the number of surgeries, we can see that we have a great amount of successful cases. So you see the numbers here, and we treat many implants. Ozone is used for treating periimplantitis, but also to prevent them from occurring. When we perform oral hygiene treatment, we can investigate and improve the health of the implant using ozone at a local level. If the area is contaminated, we treated many alveolitis. We had a decrease in symptomatology. We also performed a great deal of dental reimplanting, far more than the 32 that you see in this table. And we had an extraordinary success beside the financial aspects. But from an ethical point of view, when we can have the patient using his own teeth, this is a success. Clearly, it's easier for us to extract a tooth and eliminate the problem by implanting a new dental element. It's more complicated to recover something that is already used, meaning the old tooth. Otherwise, but however, ozone is crucial in this because I hope we can change our mind in the future. We know that there are many problems with implants, and we can decrease the array of problems created by implants using ozone, and we can improve the healing prospects for our patients. We treated infected surgical sites, and we treated herpes, stomatitis, abscesses, grafts. We treated extractions by using the bubbling to remove the coagulation, and we didn't have any alveolitis in the site. With these new pathologies arising, we used biphosphonate, and the problems connected to these medications are very frequent, and we can improve healing using ozone, and we can avoid perimplantitis. We had great success with
Qua sotto si vede proprio
perimandibular disorders. In fact, patients, after being treated with ozone for one time, they immediately asked for a second inoculation. As we said, we treated herpes labialis and fistulas, roots. Out of 10 cases we treated, we avoid surgery on 8 of them. So it was a therapy without anesthesia and without surgery. If we used anesthesia, it was just for pain. Naturally, here you see the same scope of application in the prevention, intraoperative phase, postoperative phase, in monitoring phase. Clearly, ozone can improve the healing as it has metabolic effects, and it allows hyperoxygenation of the tissues, so we can improve our daily practice using ozone. I remind you that we are working in the most contaminated area of the body, and so ozone is a great ally for our therapies. Here, it was a national congress held together with the hospital staff, and we presented the efficacy of the toothpaste. We carried out a study on disabled patients. They're usually treated in the hospital for dental care. So we cleaned their teeth and we polished the roots. We explained the patients how to maintain their oral hygiene, and we send them back home to continue with oral hygiene. We monitor them for 2 months. We monitored the plaque index, and we gave them Ozodent, the toothpaste, and we saw that without any therapy, the patients showed their results 2 months afterwards. So in 2 months' time, the plaque index remained basically the same, so we didn't have to remove tartar, or we didn't have to perform any oral hygiene intervention. We just had to use the ozone-based toothpaste, which actually reduced blooding. We can then certify the disinfection efficacy with the toothpaste. In addition, as I said, toothpaste is very convenient to use as a physical barrier. Talking about OO, in this period, Oxygen Ozone was made famous again due, unfortunately, to COVID. In fact, the metabolic, antibacterial, and immunomodulant effects of OO found a wide range of uses in treating COVID-19 patients with severe relapse or risking their lives because they were intubated were able to improve their inflammatory situation thanks to ozone, and some patients were even dismissed from the hospital. Here we see the COVID-19 ward. We see articles explaining what we did with the hospital and in internal medicine ward. This is a very defining year. We were forced to stay home for a serious problem, but we have a great solution. We need to push ozone with all its wide range of uses. It has a very wide therapeutical use, and we need to widespread it in all branches of medicine. We were able to have OO accepted in the public health sector. The ethical committee approved its use, and now it's time to go further and to use it also for other pathologies, including dentistry. So we can use ozone not only on a topic level, but also on a systemic level. Concluding, I hope you take this message away. Ozone is an unstable gas. It is unstable oxygen with a high oxidating potential. It leaves no chemical residues, so it's very environmental friendly and biological and natural. It exploits the oxidating potential to develop its antimicrobial effect. There is no resistance, nor it can cause allergic reactions because we are dealing with oxygen. It has an immunostimulant effect. It releases growth factors and has an analgesic and an anti-inflammatory effect combined with an antipoxic effect. So as we said, it's a natural biological substance that leaves no residues. It combats bacteria, so we have faster and better healing, and we have less suffering on the surgical flaps and the patients, and we can decrease the possibility of post-operative infections. This is the little booklet that we mentioned at the beginning, dating back 1950 from the Dental magazine. It's very important because in 1950 they already understood the double effect of OO. Here in this extract, you can see that besides considering the effect of the chemical properties of this molecule, we need also to take into account its electric activity. As we said, to have the combination of 3 molecules of oxygen and 2 molecules of ozone, so we spend 6,800 calories, and they will be released, in fact, producing a quantic effect, and the cells will communicate with each other thanks to the different potential in their charge. So this is another element we need to consider when using ozone. Concluding, ozone is an unstable gas that has to be produced on the spot. We need to use an electromedical generator to input oxygen, medical oxygen. The device has to be certified, and we need to be able to clearly see the ozone concentration. As I mentioned, even if ozone is not included as a drug by the drug agency, it has very important effect according to its concentration. So using a photometer, we can understand the concentration of the OO mix that we are inoculating to the patient. High concentration develop the antimicrobial effect, whereas the low concentration have a decongesting, anti-inflammatory, and metabolic. Here you see some bibliography that I used. I thank you very much for your attention, and I hope that I could trigger some curiosity in you.
All right. I think with that, we come to the end of this lovely session. I'd like to thank you, Mr. Marco, for your valuable time, and to you as well, Alessandra, for presenting the lecture of Dr. Barbando. Friends, the question and answer session will not be taking place. Your questions will be answered through email, requesting you to post in all your questions in the question and answer box. Please, so we'll make sure that all your questions are answered later. Since Dr. Babando is not here, we wouldn't be able to answer your questions. Moreover, your questions will be answered in a better way when we give them to Dr. Babando, the one who was the one whose lecture you saw, the recorded lecture. And from there, we will make sure that all your questions are getting answered. Thank you so much to everybody who joined us. Thank you to you once again, Mr. Marco, to you, Alessandra, and to the company Galvay team. Wishing and hoping to see you soon in India as well, hoping that a lot of customers from India start using your products, dive deep into the world of oxygen therapy in dentistry, getting and understanding about the various advantages and the clinical applications was fun. And we also look forward to having you for many more webinars as well. Maybe one day soon, we'd love to see Dr. Babanto live. That way we can have a very live and close interaction. So let's stay connected. Thank you, friends, and we look forward to seeing you for all our upcoming sessions as well. Stay tuned with us on events.dentistchannel.online. I repeat, events.dentistchannel.online. Another 30 seconds more for you to post in all your questions. Please post all your questions in the question and answer box. They will be automatically downloaded, and from there, we'll make sure that your questions are being answered. Thank you, friends. Good evening and goodbye. Thank you.